Hi, psyc250 students. It's time to finish up our last round of chapter presentations for exam 4. Hope you did well on exam 3. And we're going to start with Lucky 13. Chapter 13, Sexual Dysfunctions, Gender Dysphoria, and Paraphilic Disorders. For those parents who are a little concerned about some of the issues and language regarding some of the topics today, feel free to take the kids in another room. Some parents are pretty open with what their kids hear and learn about. Of course, kids have all kinds of exposure to things. They can look up things with their cell phones and so forth, but just a little fair warning in case that is an issue. This is a particularly interesting chapter. I have taught human sexuality at a different institution, and people there always started off this lecture or this course as kind of quiet and tight-lipped because there's a lot of misinformation. People are a little shy, but once people get warmed up, it was pretty free-flowing. I'm going to start off with the sexual response cycle. If you recall, Masters and Johnson, of course, in a very controversial method, talked about the sexual response cycle, which starts with excitement, and then plateau, and then orgasm, and then resolution. So what Masters and Johnson did was they recruited a number of individuals who had sexual issues and recruited surrogate partners for them if they didn't have partners. And they actually watched people engage in sexual activity, giving them surveys to fill out afterwards, or actually videotaping them, hooking up instruments to record what was going on with them physically. So as Hans Selye recorded general adaptation syndrome, looking at what was going on physically with a person, Masters and Johnson were looking at what exactly was going on with the individual physically while engaged in the sexual response cycle. And of course, with excitement, there is a generalization of all the bodily functions going into high gear, right? Increased respiration, blood flowing to the genitalia. That's the term excitement, right? Plateau, levels off, even though the body's at a high level, it levels off, and then bam, orgasm, a release of all that pent up information, all that physical realities, and then finally resolution where the body goes back to normal, right? Back to normal. So they open up the door to really kind of looking at the sexual response of an individual with another in a very scientific way, very scientific method. So we've established the norms, but what do we define as sexual deviant behavior? Well, this is where it gets very complicated, like it does with a lot of the disorders we've covered so far during the semester. When does it become abnormal? Well, this is tougher to judge because with consulting adults, they say, well, look, we both agree to this, and why would you consider abnormal? What you do in your bedroom is what you do, and what I do is what I do, right? But we have some qualifications as to what's normal and what isn't. And of course, that goes along with our normal definitions as far as a few individuals participating in such a behavior, and potentially could it be harmful to one or more individuals. And some people don't believe that cutting themselves is a very abnormal thing because that's how they relieve stress, right? But potentially it could be damaging to a person. It certainly is upsetting to people who see another individual that cuts themselves to relieve their pressure. So when we look at what we consider abnormal versus normal, we have to consider and some of this is a little dated, so things have changed, obviously, but back in the day, among the Abkhazian people of southern part of former Soviet Union, or Russia now, uh, men are sexually aroused by women's armpits. Only a husband is permitted to see a wife's armpits. So you think that's the least erogenous zone in the world, right? But to each his own, right? In some societies, they believe that men and women eating together is a mild form of sexual behavior, right? So this is why you have the separation of the genders, right? Kissing is unknown among the Suriano of Bolivia and the Tonga of Africa. The Tonga, upon learning that Europeans kiss, caused one man to say, quote, "Look at them. They eat each other's saliva and dirt," end quote. So you could see from culture to culture, experiences may vary. So let's get into the realm of dysfunction, right? According to the DSM-5, these dysfunctions has to last at least 6 months. Now, there's situational stressors that can produce some short-term dysfunctions, right? This is about 6 months or more with a person struggling with this particular issue. That issue could be anything from inability to have a drive, a sex drive. It could be an inability to obtain an orgasm. It might be something that the behavioral school would say we're not looking forward to because it causes intense pain, right? So there's a variety of different things that can happen. And of course, the research is based primarily on the female perspective. Why? It's not that men don't have sexual issues, it's just that we have more women reporting these issues, right? Because it takes two to tango, so to speak. So let's start with the sexual interest and arousal issues, right? This idea that just not interested, it just can't get aroused. Now we know that biochemically there might be some causes to this. Having negative experiences might be a causal factor in this also. Some people are actually engaged in sexual activity, but they can't obtain an orgasm. The good news about a lot of our sexual difficulties is that a lot of them are very treatable and very fixable. The bad news is a lot of folks do not want to deal with them. They're just too embarrassed. And why is that the case? Well, because from very early on, we don't really talk about sexual issues, especially in American culture. It's not the topic that we bring up at the dinner table, right? We rely on our friends. Back in my day, we would read what was on the walls in the men's bathrooms. And of course, a lot of that stuff is just nonsense and very inaccurate. Today, you can look up things on the internet, but that's not always necessarily true. We get bombarded with commercials saying, take this medication for ED, right? And you'll be just fine. Well, uh, we've had different forms of treatment over the years to treat erectile disorders or orgasmic disorders. A lot of finger pointing, a lot of blame put on people. But we know, again, biologically speaking, psychologically speaking, so we have to consider both the body and the mind, that there are some definite causalities to these issues, right? The quick draw, folks, right? Shoot first, ask questions later, premature ejaculation. There are treatment issues, treatments that we can offer that are very effective for a disorder such as that. But again, uh, getting people to acknowledge that, kind of difficult to do. Then we have folks that have pain. And again, if there's something that's going to cause you pain, that's the last thing that you want to do, right? I pulled up a plant recently, a giant palm plant from my backyard and transported it to the front of my yard. And my body was aching afterwards. It took me over an hour to pull that plant out, even with my Spidey strength, and then place it in the earth in front of my home. I wasn't looking forward to doing another one the next day, so it's still in the backyard. Maybe in a day or so, I'll do that. Aging can have an effect on sexual performance as well as the possibility of dysfunctions. Again, that's a complicated thing. People assume that old people don't engage in sex, and of course they do. But there are a lot of medications that have side effects that may impact an individual's sexual desire or ability to perform. So, where does this stuff start? Well, part of it starts with this notion of how we identify ourselves, right? And that's the topic I want to talk about today, something called gender dysphoria. Now, a lot of you grow up and you have a sense of who you are, whether you're male or female. And it's not much of an argument as to who you are. But some of us struggle with the notion that something's not quite right. Our gender is not quite right. And so, how does this happen, right? Well, that's a complicated question, and the answer is even more complicated. It's very difficult to say. Is it biologically based? Is it psychologically based? I know the cop-out answer is to say, well, it's a combination. But I truly believe it is a combination, right? If we're absolutely convinced that we are born heterosexual, homosexual, bisexual, just like we see different issues with flowers, right? You have flowers which are red, you have flowers that are white. If they cross pollinate, they may produce pink flowers. We see it in nature all the time. Then why can't we accept it in society? That some folks aren't very comfortable with the assigned gender that they've given, and they prefer to identify as a different gender. Fortunately, I've seen changes over the decades, and I've seen a lot of decades. And I've seen people become more and more open to accepting the fact that not everybody can be defined as one category or the other, male or female, that there's quite a variety. In other words, accepting the fact that there are, in fact, pink flowers besides white and red. One of the saddest cases I'm familiar with is a case study that was formerly known as John Jones, where a couple of twins were born, and one of the twins, they were both male, and one of the males, the babies, in the process of circumcision, was actually nearly had his penis severed off in the process of circumcision at the hospital. The doctors, of course, came to the parents and they said, "We're sorry, but we have a solution. We can send you home instead of with two male twins. We can send you home with a boy and a girl. We can do some reconstructive surgery here, and throughout this individual's life, we can give them hormonal treatments, and they'll become a girl." And so that's what they did with the John Jones case. And the only problem with that is they were trying to make an argument that nurture can outrank nature. Now, we've done a lot of experiments over time, but this was a horrible experiment. It didn't quite work out too well. So if you get a chance, explore the John Jones case, and you'll see that this case of gender dysphoria is pretty alive and well, because the young girl that was born biologically male never quite fit in. And the story ends very tragically. Right? We're going to continue with this interesting chapter next time. Thank you.